That's so cool. That was in your pocket the whole time. He never saw it. I can vouch for that. That is wild. All right, so if losing 10 pounds is what you want to do as well, you're in the right place. We've got the founder of Whole Life Health, Erica Robinson, here. Welcome to Daytime.
Thanks.
Now, one of the great things is you're learning, right now you're currently a student to become a naturopath.
Yes.
Which is wonderful. Tell us just briefly, a lot of people don't know what the difference between a naturopath and a traditional medical doctor is. Can you just sum it up very briefly?
Yeah, well, essentially we get the same biomedical training. So we do diagnose and treat, and we're licensed in Ontario. The difference would be in the modalities. So biomedicine or regular medicine would use more of the pharmaceutical approach, possibly surgery, sometimes lifestyle changes. We really focus on the lifestyle side of things. So making changes in your exercise, clinical nutrition is one of our modalities, physical medicine and hydrotherapy, for instance, and botanical medicine.
Clinical nutrition, I like that term,
yeah.
using food to heal, I guess, right?
Yeah,
literally.
Exactly.
Do you think it should be covered under OHIP?
At this point, I actually don't, because it would limit us. The difference between naturopaths and traditional doctors is that we spend a lot of time with our patients. So usually an hour to an hour and a half is the first visit. If we were covered under OHIP, we would probably be limited to only like 7 minutes as it is for traditional doctors.
Well, that's really interesting to hear you say that. I assumed the answer would be yes, of course, everybody should have access to it, because you have to pay out of pocket.
Yeah.
And some people may find that challenging.
Yeah.
So that's interesting that you feel you may actually have limited time with people. You'd be less effective. Interesting.
Yeah, it would totally change it.
So for the new year, a lot of people do want to make changes. One of the things you offer is basically personal training on health and lifestyle. Tell us about that.
So Whole Life is a company dedicated at making lifestyle changes. So the true things that you're going to get results with is realistically exercise and nutritional changes. So that's what we currently focus on. I'm a kinesiologist and a registered holistic nutritionist, so we're building it from there. And helping people design proper exercise programs for their body, as well as proper nutrition programs for their body.
So that's great. It's tuned to each person's
Very
abilities.
Individualized, yes.
What I've found for myself and for other people who've gone through this, sometimes you underestimate your actual abilities. You think, oh, I can't do that. Well, in actual fact, you can do that and a whole lot more. So do you find you're able to break through the barriers when you're talking to people about how much they are physically able to do?
Yes, well, I think it's important to focus on the positives and the fact that you're probably already doing a lot of great things. We're really hard critics on ourselves. So looking at the positive side of things is really helpful. And then I find just getting into it with small changes, and people are surprised how many of those small changes will lead to huge results. So they go from there.
And they notice the difference in how they feel, right?
Yeah, how they feel, how they look, and that's what it comes down to. You want to live a higher quality of life. So.
What you're saying isn't new, though. We know that it's diet and exercise. We know that.
Yeah, exactly.
Eat less, move more, eat the right things.
Yeah.
And yet we find it so challenging, so many of us. Do we have to be ready before we can take that information in, even though it's right there in front of us?
This is the issue that we're dealing with in Canada. We have the information, we know what to do, but we're not doing it yet. So I think that it comes down to having a coach really helps. Having somebody to help you look at what are your barriers and how can I make an action plan to overcome those barriers. So once you have more of a solid action plan in place, it becomes a lot easier to do.
And accountability, and having you there to help you out. I think that's when you know that someone's actually paying attention to what you're doing.
Yes, it's true. We see huge differences with that.
Is there more to it than just diet and exercise? Is there something to be said for, you've even said it, laughter?
Exactly, love, laughter. I think that those are critical things. And what I've learned I've been in this field for about 6 years now, and what I've learned is that the psychological component is huge. So if you've got a good outlook on life, if you're happy, if you do have laughter in your life, you're on a much better track to making positive changes in your life already. So it's definitely huge.
Yeah, because otherwise we can get into a rut, and then it's a self-fulfilling prophecy, isn't it? I can't do that, I don't want to, it doesn't feel good. Yeah. And exercising hard in the beginning, if you haven't done it in a long time, doesn't feel good.
No,
it does not feel good.
I always tell people the first 2 weeks you just have to deal with it, but after that it becomes a lot easier. Your muscles are more conditioned.
So here you are, this is what you teach other people. Are you challenged though in your own life? Is it still tricky for you? Like, what trips you up?
Well, definitely eating well under times of stress becomes a challenge, as I think it is for all Canadians. So trying to have healthy snacks on hand for me, but for sure, I've been doing this journey myself 6 years, and it is very challenging, but it's 2 steps forward, maybe 1 step back, but you're always making constant progress.
got some seminars coming up this month.
I do, yes.
And will those be helpful for people? Tell us about those.
They're very helpful. They start on Tuesday, and it is focusing primarily on nutrition, though there will be some lifestyle changes, stress management, stuff like that added in. And I think that they're going to be very beneficial because it teaches people really the true why of why we want to do certain things or avoid or minimize certain things that I think is lacking in our knowledge base so far.
Well, you can't underestimate the effect of stress. I had no idea when I was trying to get pregnant 5 years ago.
Yes.
I did not know that the stressful lifestyle I had led up to that point would affect my abilities to get pregnant. And so as young women especially, we feel this need to succeed and push ourselves, and that doesn't do us any good.
No, it really wreaks havoc on our hormonal system. So stress is all to do with hormones, and of course females have much more to do with hormones than men, and getting pregnant involves that as well. So.
All right, so the seminars, and we can have you come into our homes. I joked earlier with Glenn about going through cupboards, but would you actually do that to get people to get rid of their junk food?
Yes, we can go through cupboards. We do grocery trips as well. So, and really teach about label reading, because that's what it comes down to. If you can decipher a label and what it really means, you can eat anywhere, anytime, and live a healthy life.
Yeah, label readings, they throw a lot of stuff into those labels if you're not paying attention.
Hidden names, yes.
Chemicals are brutal. All right, if you want more information, how quickly do they need to sign up for these seminars?
By this weekend, typically, because they do start next week, but I do have individual ones that are anytime, as well as corporate anytime. And as long as they have a group of 4 people, we can do it in-home as a group session anytime as well.
I look forward to having you on next time as Dr. Erica.
Yes. I hope so.
And in the meantime, if you want more information on these seminars, or if you want to have Erica into your home to help you with your lifestyle plan, wholelifehealth.ca. And now, here are some events that are taking place around the city. Have a look.